Creating a Culture of Quality by Trevin Biddulph for James Madison University. So when I took a look at what really drives me at work, I started to realize the kind of things that make me happy and what I feel most proud in are the things that involve improving the quality of care provided. So what I came up with as my goal or my driving factor is creating a work environment where quality improvement is hardwired into everyday practice. And as part of the nursing leadership on the unit, it's my job to kind of set the tone and really help guide people to always wanting to provide the best quality of care. So if you look on my map at the right-hand side, I have creating the environment where quality improvement is just hardwired. And then I took a look at all the little things I'm doing, and I had to connect the dots between the two. So part of my day-to-day work, I'm the Informatics Council Admin Liaison. So I represent administration on the council. I have to report to administration on what the council's doing. Additionally, I'm also on the Quality Practice Council. I'm the intensive care unit representative, so I report up what things the ICU is doing as far as quality, and I vote on policies and procedures that relate to quality. Additionally, I'm the CAUTI-CLABSI Committee co-chair, where we really try to drive improvement in reducing CAUTIs and CLABSIs, looking at different products, nursing practice. We review the current infection rates, and we review our root cause analysis on each infection to see if there's trends. I'm on the Code Blue Review Committee. I'm the co-chair with the ICU Medical Director. I'm also working on progressive mobility and Wake Up and Breathe, where we work on getting ventilated patients less sedated, more mobile, and extubated as soon as possible. So part of that, getting people awake, breathing, and moving, is I get to help develop nurse-driven protocols that drive quality so nurses are practicing at the top of their license. So we have protocols where they can decide what to do without always checking with the doctor. Part of being on the different committee chairs is I'm representing nursing for quality improvement initiatives and patient safety. And then my work on the two Informatics Council and Quality Practice Council is improved data reporting to drive quality improvement. Part of that is I've noticed that I should probably get some sort of national certification for quality so I can really represent quality interests in nursing. So this project made me recognize what motivates me in nursing and realize what I actually like doing, and that is improving quality, and it's what makes me proud. It also forced me to take time and ponder and think about professional planning. For example, getting my certification in quality. It also made me step back and realize how much I've done so far towards quality improvement, and it made me take the steps down into manageable sizes so I could keep moving forward.